Hello everyone, welcome to today's video. We'll be talking about infections, how they are acquired, how they can be treated or cured, and the practical steps you can take to prevent them. These are health problems that affect people in many different ways. In this session, we'll look at common types of infections such as hospital-acquired infections, sexually transmitted infections, and urinary tract infections. For each one, we'll carefully explain the causes, treatment options, and prevention methods, so pay close attention. This information is not just for learning, it's for your protection. If you, a friend, or a family member ever face one of these infections, you'll know what to do, how to seek the right treatment, and how to reduce your risk of getting infected in the first place. By the end of this video, you'll have a clear understanding of the causes, cures, and prevention strategies for these infections, helping you take charge of your health and safety. Let's begin with hospital-acquired infections, also known as nosocomial infections. These are infections that patients develop while receiving care in a hospital or other healthcare facility. In simple terms, they are not present at the time of admission but appear 48 hours or more after hospitalization or even shortly after discharge. Common examples include surgical site infections, bloodstream infections, pneumonia linked to ventilators, and urinary tract infections caused by catheters. They often happen because patients in hospitals may already have weakened immune systems, undergo surgeries, or use devices like forelines and catheters that can allow germs to enter the body. Hospital-acquired infections. When we talk about hospital-acquired infections, we mean infections that develop while someone is receiving care in a hospital or health facility. Let's look at some of the most common ones, how they happen. 1. Surgical site infections. After surgery, the cut or wound made during the procedure can sometimes get infected if bacteria find their way in. This can happen through unclean instruments, poor wound care, or even by touching the wound with dirty hands. If such an infection develops, doctors usually treat it with antibiotics and proper wound cleaning. In more serious cases, a second procedure may be needed to remove infected tissue. 3. Bloodstream infections. These often happen when germs enter the blood through intravenous lines or catheters. Since the bloodstream carries germs throughout the body, this kind of infection can quickly become dangerous. If you develop one, immediate treatment with strong antibiotics is required, and the infected foreline may need to be removed. 3. Ventilator-associated pneumonia. Patients who rely on breathing machines or ventilators are at risk of pneumonia because germs can travel down the tube into the lungs. This makes recovery harder and can prolong hospital stays. If this infection occurs, doctors treat it with antibiotics and supportive care, such as oxygen therapy. 4. Catheter-associated urinary tract infections. Urinary catheters, which are tubes used to drain urine, can sometimes let bacteria into the urinary tract, especially if the catheter stays in too long. If an infection happens, antibiotics are used, and the catheter may need to be replaced or removed. Many patients, whether admitted in the hospital, visiting for treatment, or undergoing surgery, are at risk of hospital-acquired infections. These infections can be serious, but the good news is that there are effective ways to prevent them. Every patient, family member, and healthcare worker has a role to play in protection. Ways to prevent hospital-acquired infections. 1. Hand hygiene. Washing hands with soap and clean water or using alcohol-based sanitizers before and after touching patients, equipment, or wounds. Patients and visitors should also clean their hands regularly. 2. Use of protective equipment. Gloves, masks, gowns, and face shields must be used where necessary to prevent the spread of germs. Patients should not hesitate to remind healthcare workers to use them. 3. Safe use of catheters and tubes. Catheters, forelines, and feeding tubes are common sources of infection. They should only be used when absolutely needed, inserted under sterile conditions, and removed as soon as they are no longer necessary. 4. Surgical site care. The skin should be cleaned properly before surgery. Sterile instruments and environments are essential. After surgery, dressings should be changed regularly, and patients must keep the wound clean and dry. 5. Environmental cleanliness. Hospital surfaces, beds, equipment, and toilets should be cleaned and disinfected regularly. Visitors should also respect hospital rules about hygiene and restricted areas. 6. Proper antibiotic use. Antibiotics should only be taken when prescribed by a doctor. Misuse or overuse increases resistance and makes infections harder to treat. 7. Isolation of infectious patients. Patients with contagious infections may need to be kept in separate rooms to prevent spread. Visitors must follow the hospital's guidance when entering isolation areas. 8. Vaccination. Both patients and healthcare workers should be up to date with vaccines, like flu and COVID-19, which lower the risk of hospital outbreaks. 9. Patient awareness and involvement. Patients should ask questions about their treatment and care. Report any signs of infection early, such as fever, redness, swelling, pus, or pain at a wound or catheter site. Now, let's move on to another important group, sexual transmitted infections, often called STIs. STIs are infections that are mainly passed from one person to another through sexual contact, vaginal, anal, or oral. They spread when germs such as bacteria, viruses, or parasites move from an infected person to their partner. Some sexually transmitted infections may also spread through blood, shared needles, or from mother to baby during pregnancy and childbirth. Common types of sexually transmitted infections. 1. HIV/AIDS, caused by a virus that weakens the immune system. 2. Syphilis, a bacterial infection that progresses in stages if untreated. 3. Gonorrhea, a bacterial infection affecting the genital tract, rectum, and throat. 4. Chlamydia, a bacterial infection that often has no symptoms but can cause serious complications. 5. Human papillomavirus, HPV, a viral infection that can cause genital warts and increase cancer risk. 6. Herpes simplex virus, HSV, causes painful sores around the mouth or genitals. 7. Trichomoniasis, caused by a parasite leading to itching and discharge. 8. Hepatitis B, a viral infection that damages the liver and can be sexually transmitted. Many people around the world have suffered from sexually transmitted infections, STIs. But the good news is that there are safe and effective ways to protect yourself. By making smart choices such as 1. Abstinence. Not having sex. The only 100% effective way to avoid STDs is to avoid vaginal, anal, and oral sex. Especially recommended for people who are not ready to handle the risks. 2. Use condoms correctly and consistently. Male or female condoms act as a barrier that reduces the chance of infection. Must be used every time you have sex. Important. Condoms don't fully protect against infections spread by skin-to-skin contact, like herpes or HPV, if sores are outside the covered area. 3. Limit the number of sexual partners. The more partners you have, the higher the risk of exposure. Being in a mutually monogamous relationship with an uninfected partner greatly lowers risk. 4. Get tested and know your status. Many STDs show no symptoms. Regular testing helps detect infections early. Encourage your partners to get tested too before starting a sexual relationship. 5. Avoid alcohol and drug use before sex. Being drunk or high makes it harder to make safe choices. It increases the chances of unprotected sex or risky behavior. Vaccination. Some STDs can be prevented through vaccines. HPV vaccine prevents cervical, anal, throat cancers and genital warts. Hepatitis B vaccine prevents liver infection and complications. 7. Avoid sharing needles or sharp objects. HIV and hepatitis B and C can spread through contaminated needles, syringes, or even unsterilized tattoo, piercing tools. Always ensure clean and sterile equipment is used. 8. Practice safe oral sex. Use dental dams, thin latex sheets, or condoms during oral sex. This reduces the risk of herpes, gonorrhea, syphilis, and HPV transmission. 9. Be alert to symptoms, yours and your partner's. If you or your partner have sores, discharge, burning sensation, rashes, or unusual odor, avoid sex and get checked immediately. 10. Seek early treatment if infected. If you test positive for an STD, follow your healthcare provider's treatment. Finish all medications, for example, antibiotics for gonorrhea or chlamydia. Inform your partners so they can also be treated to prevent reinfection. Finally, let's talk about the last type of infection, urinary tract infections, UTIs. Urinary tract infections, commonly known as UTIs. Urinary tract infection, UTI, is an infection that affects the parts of the body that make and pass urine, including the kidneys, bladder, ureters, and urethra. It happens when bacteria, usually E. coli from the genital or anal area, enter the urethra and travel into the bladder, where they multiply and cause infection. Here are the main causes of urinary tract infections, UTIs. Poor hygiene after using the toilet. When someone doesn't clean properly after using the toilet, bacteria from the stool can move to the urinary opening and enter the bladder. This is one of the most common causes of UTIs, especially in women. Not drinking enough water. Water helps flush out bacteria through urine. If you don't drink enough, your body won't produce enough urine to clean the urinary tract, making it easier for germs to grow. Holding urine for long periods. Keeping urine in the bladder for too long gives bacteria more time to multiply. This increases the risk of infection and discomfort. Having a urinary catheter for too long. Catheters provide a direct pathway for germs to enter the bladder. The longer a catheter stays inside, the higher the chance of infection. Sexual activity without proper hygiene. During sex, bacteria around the genital area can move into the urinary tract. Not cleaning before and after sex increases the risk of infection. Incomplete emptying of the bladder, common in older adults. If the bladder doesn't empty fully, leftover urine becomes a breeding ground for bacteria. This is often seen in older adults or those with certain medical conditions. Signs and symptoms. When you see these, you might have a UTI. Burning sensation or pain when urinating. This is the most common sign of a UTI, caused by irritation of the urinary tract lining. Frequent urge to urinate, even when little urine comes out. The bladder feels irritated, so you keep feeling like you need to go, but only small amounts come out. Cloudy, bad smelling, or blood-stained urine. Infection changes the look and smell of urine. In some cases, blood may appear, showing the infection has irritated the bladder walls. Lower abdominal pain or back pain. Pain in the lower tummy or back may mean the infection is spreading to the kidneys. Fever and chills. In severe infections, especially if kidneys are involved, a high temperature shows the infection has become more serious and needs urgent treatment. Best ways to prevent UTIs: drink plenty of clean water to flush bacteria out. Staying hydrated helps wash bacteria away before they can cause infection. Always wipe from front to back after using the toilet. This prevents germs from the anal area moving toward the urinary opening. Empty the bladder regularly, and don't hold urine for long. Regular urination removes bacteria and reduces the chance of infection. Practice good hygiene before and after sexual activity. Cleaning up helps remove bacteria that could enter the urinary tract during intimacy. For patients with catheters, ensure catheters are managed under sterile conditions, and remove them as soon as possible. Proper care and timely removal greatly lower the risk of infection. Wear clean, breathable cotton underwear to reduce moisture buildup. Cotton keeps the area dry, making it harder for bacteria to thrive. What to do if you suspect a UTI? Seek medical care immediately. UTIs can get worse quickly if not treated, so don't wait. Your doctor may prescribe antibiotics to clear the infection. These medicines kill the bacteria causing the UTI. Finish the full course of treatment, even if you feel better. Stopping early may leave some bacteria alive, and the infection can come back stronger. All these types of infections, whether hospital-acquired infections, sexually transmitted infections, or urinary tract infections, are very dangerous to your health. They can make you very sick. But the good news is that if you notice the signs early and seek treatment, most infections can be cured. However, if ignored and left untreated for too long, they can lead to serious complications, long-term health problems, or even become life-threatening. So please, take good care of your health. Always practice good hygiene, go for regular checkups, and don't be afraid to see a doctor if something feels wrong. Prevention is always better than cure. If you've not yet subscribed to this channel, kindly do so, and remember to share this video with your friends, family members, or in groups so that many people can also benefit. Because your health matters, and together we can stay healthier and safer.